Hello and welcome to 2021 In-Service Bloodborne Pathogens. Please take a moment to review your training objectives. The Bloodborne Pathogen Standard 29 CFR 1910-1030. The Occupational Safety and Health Administration first implemented the Bloodborne Pathogen Standard in July of 1992. It was revised in January of 2001. The OSHA regulations apply to all private employers with more than 10 employees and employees of the federal government. The purpose of the standard is to publish occupational safety guidelines and regulations to reduce or eliminate employee exposure to bloodborne pathogens. Bloodborne pathogens, virus and infectious agents which are carried in human blood and other potential infectious materials are considered bloodborne pathogens. The ones most often mentioned are hepatitis B virus, hepatitis C virus, human immune deficiency virus, HIV, and other resistant viruses such as MRSA. Other potential infectious materials, bloodborne pathogens, can also be contained in other bodily fluids. These include semen, vaginal secretions, saliva, amniotic fluid, and other bodily fluid or matter in which may contain blood. Exposure. Any incident where the employee has non-intact skin, eye, mouth, mucous membrane, contact with blood or other potential infectious materials. Exposure control. These include administrative controls such as providing vaccinations, infection, preventative procedures, and training programs. Engineering controls are physical barriers to exposure such as sharp, safe evidence containers and biohazard labels, as well as eye and hand washing stations. Work practice controls, actual procedures following to reduce exposure. Work practice controls make the administrative and engineering controls effective. All the policies and labels in the world will not help if they are not used. Work practice control also involve the use of personal protective equipment, which will be discussed later in this outline. Symptoms and epidemiology. There are many bloodborne diseases, and we're going to talk about a few. The first one, hepatitis B. We're all familiar with it and have learned it in the past. Again, this affects the liver, and there's over 5.7 million people in the United States that are affected by this. And these again are HBV and HCV. Some of the signs and symptoms are jaundice, fatigue, fever, loss of appetite, nausea, abdominal pain. Hepatitis C is also very common among chronic bloodborne pathogen diseases. Affects quite a few people in the United States. There's no vaccine for HCV. HIV, human immune deficiency virus, also known as AIDS, is when the body is unable to defend itself against infection and mutated cells. Again, several million people in the United States are living with HIV. Some of the signs and symptoms are night sweats, headaches, fever, fatigue, muscle pain, joint pain. Other diseases, bloodborne pathogen diseases, are MRSA. MRSA is a staph infection. Signs and symptoms can be similar to like a spider bite. However, unless you actually see the spider, it's not most likely a spider bite, but a skin infection, which again is also known as MRSA. It can appear as a bump in affected area, maybe red, swollen, painful, warm to the touch. Also could be accompanied by a fever. Modes of transmission. The 5 main methods of transmission of bloodborne pathogens are contact, droplet, air, food, and vector. The first 3 are the most common and most likely which you're exposed to in the workplace. Contact exposure. This is the most common mode of exposure. This just would be direct contact, which is exposure occurs when the pathogen is passed directly from one person to another. Indirect is when contact exposure occurs when the pathogen is contracted by touching the surface or material where an infected blood or other potential material was left. Droplet exposure. This type of exposure occurs when droplets of blood or other potential infectious material containing infectious pathogens are expelled during coughing, sneezing, talking, and transferred to that person through mucous membranes. This typically takes place from a distance up to 6 feet. Airborne exposure are similar to droplet exposure, but airborne exposures take place when an infected person expels blood or other infectious material when sneezing, coughing, etc., and the pathogen enters the body through microdroplets through the respiratory tract. Risk of exposure. Law enforcement officers are always at great risk of exposure to many tasks that we perform on a daily basis. Direct contact with those infected or hosting bloodborne pathogens while we provide medical or first aid care, being bitten by a suspect. Indirect, while we are processing a crime scene, touching contaminated surfaces, being stuck by a suspect's hypodermic needle. Droplet through airborne exposure may occur anytime when the officer is close to someone who's hosting a bloodborne pathogen. Activities from taking a report, talking to a victim, all that puts us at risk. Helping minimize the risk. There's some precautions that we can take to help minimize our risk of getting contaminated with bloodborne pathogens. The standard precautions are avoid any contact with blood or other potential infectious materials. Wear disposable gloves when touching individuals, and change gloves when you're touching different people. Cover up any cuts, scrapes while you're working. Use personal protective PPE. Wash hands or use sanitizer whenever possible. Dispose all contaminated PPE carefully, properly. Clean all disinfectant clothing, equipment which may be contaminated. Transmission-based precautions. Transmission-based precautions are used in addition to standard precautions. They should also be used when dealing with individuals who are known to be infected. Again, this may be utilizing gloves, PPE, also using a mask. Workplace controls. As mentioned earlier, workplace controls are procedures which must be followed to maintain safety in the workplace. Work practice controls include no smoking, eating, drinking, or handling contact while you contact lenses or applying makeup, lip balm. Also, food should not be stored in the refrigerator where there's evidence stored also. Personal protective equipment or PPE. Personal protective equipment is specially designed for clothing or equipment which is worn to protect against bloodborne hazards. One type is gloves. Disposable gloves should be worn anytime there's a risk, whether perceived or actual. Gloves should be worn even if you do not have any areas of non-intact skin. Gowns when processing a crime scene where there's a possibility of splattering or splashing, or providing emergency medical care to a victim with mass trauma, a gown should be worn. Mask should be used anytime there's a chance of splashing or splattering of blood or other potential infectious materials in order to protect mucous membranes or nasal passages. And again, we're all accustomed to wearing masks now. Eye protection. If there's a risk of exposure of blood, other potential infectious materials, splashing or splattering of mucous membranes in the eyes should be protected. This can be accomplished by a safe mask or a face mask or safety glasses. Normal prescription eyewear is not sufficient protection. CPR shields. Whenever you're giving rescue breaths, you should use a CPR breathing barrier. There's a variety of these, but anytime that you're giving rescue breaths, a mask should be used. And anytime evidence or other materials are being stored, there should be proper packaging and disposal. Exposure control plan. Every agency's exposure control plan is reviewed annually and updated as needed. The plan must include a list of employees, the job classification, and the schedule of methods of implementation of all elements of this plan if there was an exposure. Every employee should be given an opportunity to receive the HPV vaccine if needed or if wanted. Also, actions must be taken to include the name of the position and title of a person to contact if there is an exposure. There should also be exposure incident takes place. The employee must provide the employee with confidential medical evaluation and follow-ups. This evaluation must be conducted by a licensed healthcare professional and must have the following elements: documentation of the route of exposure and circumstances surrounding the exposure, identification and documentation of the source individual. North Carolina requires that the source individual be tested unless the individual is already known to be positive for HIV or HPV. Results of the test are to be provided to the employee, but the employee must be made aware of the confidential requirements regarding this information. The employee's blood must be collected and sampled unless the employee does not want their blood tested. If that is the case, the blood must be kept for 90 days in case the employee changes their mind. Any post-exposure prevention measures will also be recommended by the CDC. Also provide counseling and evaluation of any reported illnesses. In conclusion, we have discussed many aspects of dealing with bloodborne pathogens. As we have seen, these concerns are very real and should be a constant concern for law enforcement professionals. Just because we cannot see the danger does not mean we can let down our guard. Our training objectives for this block of instruction will review the purpose of bloodborne pathogen standard in OSHA 29 CFR 1910-1030. We characterize the general symptoms and epidemiology of bloodborne diseases. We discuss the modes of transmission of bloodborne pathogens. We identify tasks and other activities which may involve exposure to blood or other potential infectious materials. We demonstrated methods which to prevent or reduce exposure to blood or other potential infectious materials. We illustrated the appropriate selection, storage, and use disposal of personal protective equipment, PPE, and we outlined the components of the employee's bloodborne exposure control plan to include appropriate action and persons to contact emergency involving blood and other potential infectious materials, procedure to follow if an exposure incident occurs, and information on post-exposure evaluation and follow-up.